systems work, in specific the European countries versus the American system in general. Then we're going to get just a little back and forth going, a little debate, conversation, get you guys involved, and we'll call it a day.
Okay. So the first part, it's actually cut off from the top, but it's a list of legislations before Obamacare. So before Obamacare, there were several legislations that were passed. Starting from 1980, these were the last, well, 5, in 2005, 2003, 1996, and 1986. So the first one that was passed, the most recent one, which is the Patient Safety and Quality Improvement Act, that had to deal more with safety of medications, like for the FDA, making sure that the drugs were doing what they were supposed to do, and mostly also for the safety of the patients in the terms of confidentiality also. So to make sure that what was happening to the patients, no one else would know except the patients and the doctors and whoever else was involved. The one before that, which was the Medicare Prescription Drug Plan Improvement and Modernization Act, the majority of that plan was the introduction of Medicaid Part D, which a lot of people who work in pharmacies would know that it's for people who are over the age of, I believe, 65. They would have a Medicare that would always cover a majority of prescriptions, a set of prescriptions that are deemed necessary by the FDA. The next one, which is the HIPAA, which is the Health Insurance Portability and Accountability Act, which is also known as HIPAA. The HIPAA laws, which are also for confidentiality between patients and doctors, doctors and, say, pharmacists, doctors and other doctors, to make sure that no information besides what the patients had to know were being leaked out. And then there was also the Emergency Medical Treatment and Active Labor Act. This would probably be the closest as what people would think about as socialized healthcare, because it's basically, this act said that if someone was in need of emergency care, whether regards of citizenship, legal residence, if they can pay for it or not, they had to be treated first before anything else was put into accountability.
Okay, on March 23rd, 2010, President Obama signed the bill to make the newly reformed healthcare bill into a law, which basically, it's a 10-year process to create universal healthcare coverage in America. It will not, the Healthcare Act will not be all implemented at once. Several immediate effects of the law include providing more coverage, reducing the donut hole, and providing tax credits for small businesses. Now, adults who have been denied coverage because of pre-existing conditions will finally be insured under the federally subsidized insurance program. Insurance companies will no longer be able to deny people coverage because of pre-existing conditions or illnesses. Now, insurance companies will also not be allowed to drop children under the age of 19 because of pre-existing conditions, and will allow these children to be covered under their family plan until the age of 26. The law also reduces the donut hole or coverage gap by reducing the cost of brand prescriptions by 50% once a patient has exceeded the coverage policy. And by 2020, this gap will be closed. Now, just a little bit of information about the donut hole. If you join a Medicare prescription drug plan, you may have to pay up to the first $310 of your drug cost, and this is what it's called the deductible. And during the initial coverage phase, you pay a co-payment, co-insurance, and your Part D drug pays a share of the coverage of drug until you reach a combined amount of $2,840. Basically, the co-payment is a percentage of the total drug that you pay. And until you reach, back in the former health bill, if you reach $2,840, after you exceeded that limit, people were then had to pay 100% for their brand drugs. Now, after this healthcare bill is implemented, you would get a 50% discount on covered brand name prescription drugs. And the donut hole continues until your total out-of-pocket cost reaches $4,550. This annual out-of-pocket spending amount includes your yearly deductible, co-payment, and co-insurance amount. And when you spend more than the $4,550 out-of-pocket, the coverage gap ends, and your drug plan pays most of the coverage of your covered drug for the remainder of the year. You'll then be responsible for a small co-payment, which is called the catastrophic coverage. Now, long-term effects of the Obama healthcare law is universal coverage. By 2014, all Americans are expected to have insurance or face fines depending on household incomes. Larger companies with employees with more than 50 employees are responsible to cover their workers. And people who cannot afford the insurance will receive tax credits relative to their income to help them purchase insurance. It also creates state-based healthcare insurance exchange where various insurance plans will be available, and any individual will be able to choose among them. Basically, there'll be multiple plans, state plans, which you could choose which one is the most ideal for yourself. Now, to pay for this healthcare, the government has raised taxes on the wealthy and on insurance companies, what Democrats usually do. Individuals making more than $200,000 a year and married couples making more than $250,000 a year would have to pay 0.9% on their tax rate for Medicare. These individuals also have to pay 3.8% tax on unearned incomes. And also between the years of 2011 and 2019, drug manufacturers will have to pay the government a total of $16 billion, and insurance companies will have to pay the government a total of $47 billion. And the government justifies this by saying that because of the different options of healthcare, it'll bring in many more customers, which ultimately the insurance companies will have a profit from it. Now, and also like a small part about the pharmacist, the impact of the Obama healthcare on pharmacists. Basically, through medication therapy management, pharmacists are basically given a grant to provide basically medical therapy towards for prescriptions, so patients understand more about their medication, about the side effects, about what they can or cannot do, and whatnot.
So healthcare system in Spain. First of all, most of Europe is under the same healthcare system. However, there's still a few differences among the countries. You must apply for a European health insurance card. It will not cover ongoing conditions such as terminal illnesses and full maternity care or vaccinations. Usually, people who choose to retire in Spain are self-employed, students, or unemployed before leaving to go to Spain are given at least 2 years' worth of healthcare insurance. Nurses do not do as much as they do in America. For patients who have a terminal illness, for example, and they need long-term care, the family is expected to be giving personal care and feed them on a daily basis. The family is actively involved in their rehabilitation process, and they allow at least one companion to be with the patient 24 hours a day. Unlike in most European countries who are at least competent with English, Spain is really not, because Spanish is the third most commonly spoken language, and therefore it is less common to have another language. French ranks as 9th, and Italian ranks as 24th, which contributes to the heavy language barrier they have there. There are some prescription drugs that are sold over the counter in Spain that are not in America, and vice versa. And some health facts about Spain itself. Spanish people are among the world's healthiest people, within the average lifespan of 80 for women and 74 for men. Eastern Mediterranean areas are the most healthy. It's also the most populated area, and it's also where most of the trade goes on in the first place. Public medicine is barely sufficient in the inland areas of low population. Conditions such as rheumatism and arthritis sufferers note a very huge improvement since they moved to Spain. Some of which can be explained because this is possibly because family members are actively helping out with their recovery. And lastly, Spain itself has a very warm and sunny climate, which generally makes people happier and less prone to colds and boosts their immune systems. That being said, due to the sun, skin cancer is more common in Spain than most of Europe.
Okay, healthcare in France, the country we're in now, it's way more regulated than we have back at home. The government in France takes a stronger stance on many more things than we do back at home. It's viewed as a more centralized government. The taxes here are considerably way higher than we have at home, which usually means that there's more resources for public expenditures. The government can spend more on things that will benefit the general instead of benefiting businesses. The healthcare system here in France specifically combines both the public aspect where everyone's insured. I believe 99% of people have coverage here in France, and also the private aspect. You're also, here in France, you're allowed to go out and find your own health insurance. If you don't want to go to a public hospital, you're more than welcome to go to a private one. In terms of cost, I found that it was extremely efficient in consideration when you compare the GDP per person and how much they spent here towards how much was spent in America per person. That's a little confusing, but basically per person, France spends less on healthcare than we do back at home, but at the same time the French system is way more efficient than we do have back at home. It was actually ranked by the World Health Organization as the best health system in the world, and that goes by health expectancy, how much the government spends per person, and the hospital situations they have here. I believe for every 1,000 citizens they have 9 hospital beds, which is pretty efficient. It's really nice. It's assuring for the citizens. People are insured under something specifically called the NHI, which is the National Health Insurance System. And that pretty much covers both the political and social aspects of the healthcare system here in France.
Alright, Italy, which is where we're going to go in about a week or two, has the same system, but in Italian it's called Servizio Sanitario Nazionale. Sorry for its pronunciation. The doctors there are actually very dedicated and caring, actually reviewed by like several nations, and their private hospitals are actually among the best among the world, and their state hospital, that is generally where they're lacking, but it's still actually very efficient. The national health system is actually administered by the local health officials, and this system allows them to get health insurance at very low to no cost, and it includes the following like inpatient treatment visits and any medical assistance that you need. And this insurance goes for EU citizens and non-EU citizens. So the moment you step in Italy, you actually already have some coverage, no matter where you're from. Private hospital is actually the best out of anywhere. The quality of it is actually the same as a 5-star hotel, because the bathrooms are all inside your suite, and you have air conditioners, and you have extra beds for anyone who's visiting you. However, their medical equipment might not be the best, and because of that, you're not advised to go to a private hospital for any emergency conditions, because in case of an emergency, they might not be able to accommodate your needs. And also, private hospitals are very costly, and in the majority of cases, they're not covered by insurance. And here is your state hospital. This is covered by your state health. However, they are really like backed up, and they have long queues of patients. The nurses are actually always busy, so there's always a long wait. And due to this, if you ever go into a hospital, a state hospital, and you feel like the wait time is too long, you actually have the right to be to ask for a transfer, and they will transfer you without any question. And their coverage is actually mixed between private and state. However, study shows that many people prefer private coverage because it allows them to go to any clinic that they want, and private coverage, the clinics tend to have a shorter wait time, which is better.
So now I'm going to go over some pros and cons about universal healthcare. As you all probably know, there's a huge debate in the United States going on. So I'm just going to run through a couple of points that each side has. So first of all, The number of uninsured U.S. residents has grown to over 45 million. That's including illegal immigrants. And so basically the universal health care will almost eliminate this statistic. Number 2, healthcare has become increasingly unaffordable for business and individuals. And so with universal health care, businesses will no longer have to pay for their employees' insurance. Third, we can eliminate wasteful inefficiencies such as duplicate paperwork, claim approval, insurance submission, etc. We can develop a centralized national database which makes diagnosis and treatment easier for doctors and for pharmacists. Medical professionals can concentrate on healing the patient rather than on insurance procedures, malpractice, liability, etc. Free medical services would encourage patients to practice preventative medicine and inquire about problems earlier when treatment will be light. Currently, patients often avoid physicals and other preventative measures because of their costs. 7th, guaranteeing the right to health care will encourage entrepreneurship, which is good for job creation. Currently, people are afraid to start their own business for fear of losing the health insurance provided at their existing job. Patients with pre-existing conditions will get health coverage. As you probably know, some insurance companies won't accept a person under their plan if they're known to have a chronic illness that costs them too much money. 9th, providing all citizens the right to health care is good for economic productivity, as we learned in economics. When people have access to health care, they live healthier and longer lives, and this allows them to contribute to society for a longer period of time. And last point, coverage of all Americans would best counter or contain the spreading of epidemics such as the H1N1 flu or smallpox and such. Oh, okay. Some cons about universal health care. Providing health care to everyone is a huge expense and will result in tax increases or spending cuts, which could harm the economy and the individual. In other words, free health care isn't really free. Some of these spending cuts could be taken out of areas such as defense or education, which are very important. Government-controlled healthcare would lead to a decrease in patient flexibility, kind of self-explanatory. Patients aren't likely to curb their drug costs and doctor visits if healthcare is free. Thus, the total cost of healthcare would increase. 4th, just because Americans are uninsured doesn't mean that they can't receive healthcare. There are nonprofits and government-run hospitals that provide services to those who don't have insurance, and it is illegal to refuse emergency medical service because of lack of insurance. Providing a right to healthcare is socialism and is bad for economic productivity. What they mean by this is socialized medicine is comparable to food stamps, housing subsidies, and welfare, all of which are charity. So distributing charity to society, they will say, makes people lazy and decreases the incentive for people to strive for excellence, which inhibits productivity of the nation. Guaranteeing healthcare as a right will lead to an increase in demand for healthcare that will decrease the quality of care because healthcare professionals will be overstretched. This is for doctors and for pharmacists. Healthy people who take care of themselves will have to pay for the burden of those who smoke, are obese, etc. Diseases and health problems such as obesity, cancer, stroke, diabetes, etc. can be prevented by individuals if they just lived healthier lifestyles. Also, in an effort to cut costs, price and salary controls on drugs, medical equipment, and medical services are likely to be put in place, meaning that there is less incentive to pursue medical-related research, development, investment, nor pursue medical careers in general. Also, a long, painful transition will have to take place involving loss of insurance jobs, business closures, and new patient record creation. 10th point, loss of private practice options and possible reduced pay may dissuade would-be doctors from pursuing the profession, as I've already said. Patient confidentiality is likely to be compromised since the government will likely maintain a centralized health information of each patient. 12th, healthcare equipment, drugs, and services may end up being rationed by the government. In other words, politics, lifestyle of patients, and philosophical differences of those in power could determine who gets what. And last point of the cons, patients may be subjected to extremely long waits to receive diagnoses and treatment of illness, as in the case in Canada and the UK, where patients were potentially denied medical care for chronic diseases.
how we want to get you guys involved. So, as you all know, you will be directly affected by the healthcare system one way or another. A lot of us here are pharmacy students, but even if you aren't, you're going to use the healthcare system some point in your life. So, before I give my personal opinion, does anyone have anything that they would like to say? Any views on the healthcare system whatsoever? Universal healthcare? Yeah.
Well, it seems like the United States is trying to move more towards a European healthcare system, based on what you guys said, and it seemed like the cons pretty much outweighed the pros in the last stuff that you presented. So, at first, when I first heard of Obamacare, I guess I was a fan, but after hearing this presentation, I might not be so much of a fan. But I'm interested to hear what I'm pretty sure you guys have conflicting ideas on what's right and what's wrong. I'm intrigued by what you guys are going to say.
Well, what exactly about Obamacare didn't you think was attractive?
Well, I mean, I guess I just wasn't as well versed on it as I thought I was.
Yeah. I mean,
I think it's going to be a lot more expensive than people projected to be. And also that I feel like since we're in such a bad economical place, it's kind of rushed. And that when the economy bounces back, I mean, we've never really heard of anything of healthcare. I mean, me personally, I've never heard anything in the news or anything like that about healthcare and the cost of it prior to the economy going in to for lack of a better word, shitter. And so I feel like when the economy recovers, maybe that won't be so much of a big issue.
but I mean, if you think about it, isn't a time where there is no economic stability the best time to introduce a healthcare system because that's when people need it most?
You're right. You're right, but if the economy bounces back and people are able to pay for their own health, we end up in a socialist system. That not what we want.
I mean, but there's always going to be a time and place where people won't be able to afford healthcare. Do you think that at any certain point people should be denied healthcare because they can't afford it? Especially in a country like America where we were built on life, liberty, and the pursuit of happiness.
I definitely agree with that, but I feel like there's no perfect system, you know what I mean? So like, I mean, I don't know what the ramifications of this system is, and I don't think anyone can really project what it's going to be. But I hope it ends up being like France, you know, and how they have it worked out so well, but I think there's going to be some bumps in the road, and a lot of people are going to be upset with it.
I just want to say something real quick. Just keep in mind that all of us have different opinions. So like for example, like I did the pros and cons, and I am against universal healthcare. So I tried to make it as non-biased as possible, but maybe like part of me subconsciously made it more biased toward the cons.
Yeah, definitely. I'm interested to hear, like I said, to hear what you guys have to say.
Anybody else have an opinion?
I mean, you need, first of all, healthcare professionals in order to have universal healthcare. And what's going to give you any incentive to be a doctor when if you're going to make more than $200,000 and get taxed higher and have to do more work? There's absolutely no incentive to become a healthcare professional anymore. So,
well,
if it's there, like...
The thing that they do in France is they allocate a large portion of the NHI's budget simply to train and specialized healthcare professionals, and that's an incentive to a lot of uprising healthcare professionals here in France.
Well, that's in France, but in America, you know you do it for the money majority of the time. Is that not true?
Yeah, but...
And if you're going to decrease payout overall, then increase work, why would you want to do this anymore? Especially with nurses.
I totally agree. Like, why? We're going to be going to school for so long, we work so hard, and you're going to tax us on our higher incomes and give out universal health care when we work so hard. Why aren't we getting the pay that we should be getting back for the work we're putting into it? It just doesn't make sense.
I feel like the money that's also going into it you guys will get a piece of the pie, you know what I mean? Like all this money's going to be coming into it, and I feel like they will look at the doctors and the healthcare providers and give you guys a cut of it. Otherwise, like you said, the incentive is lost and a whole field is diminished.
Even with nurses, are they not overworked right now? How many times do you hear issues with nurses? And if you give them even more work, what do you think is going to happen?
Anyone else want to? I think that the whole situation's kind of ironic where health professionals are worrying about their wage when they're in the profession supposedly to help the better good. And you're kind of avoiding that by worrying more about your wage than what your job is truly for. I mean, of course, that's like the utopian society and it doesn't exist here, but just putting it out there.
But America's always going to have a high
That's what I'm saying,
standard of
it's all
living.
about it,
Like, we're always going to live where we want to live. We don't want to live in, like, I don't know, like, I'd rather live in a nicer place and have a higher standard of living and make a better income than sacrifice that, I
But
guess.
the
Then
thing-
you always have to think about the people at the bottom who don't have that, who aren't getting health care, and they're just kind of, there's nothing for them to do, like there's nowhere for them to go. Now they're sick and they can't do anything about it.
A little thing, a little thing to, oh, you go.
Keep in mind also that the poor would want to benefit themselves if they're not handed free stuff. If they want, don't you think that they should give the incentive to strive for something better than what their current conditions are? So if you keep on handing them out free stuff, the incentive is gone, and they're never gonna progress. Plus, you have there's no incentive for upper class to pursue. I'm not saying upper class can only pursue it, but nobody would want to become doctors or healthcare professionals because of this too. So now you're gonna kind of bring the entire economy down.
A little thing, you're really big on pursuit of happiness, but the pursuit of happiness, it was debated many times because at first pursuit of happiness means you do whatever you want that you make you happy. But the thing is, if you do something that makes you happy at the cost of someone else's happiness, is that really justifiable? Just because you're taxing everyone on their money just to give everyone free healthcare, you're depriving one person of their pursuit of happiness to give another person the pursuit of happiness.
I mean,
Happiness, not the distribution of happiness.
I mean, does the person making over $1 million really need the whole $1 million? That's that kind of an argument, in my opinion. Do you think, I'm not saying that they should be taxed to a level where, I mean, back in Great Britain, back in the day, they used to tax people who made over a certain point at 100% of what they made after that point. I'm not saying something like that, but something like they have here in France where individuals lose about 40% of their income if they're making one that's ridiculously high and is not necessary for, you know, the necessities in life. You really don't need like 5 porches. I don't know if you guys do, but
But like another thing is like, there was a point that was brought up by Mike, if someone takes care of themselves, is healthy, because I know you're a really big person on eating healthy, exercising and everything, and someone else who's obese because they eat McDonald's every day, and they have like a Big Mac every second hour. Do you really think that your money should go towards to someone like that, just because they choose to eat that Big Mac every 2 hours, where you choose to make your own sandwiches 3 times a day and have a healthy meal?
See, you can make that point, but you can also make the point of the child who's sick and can't get any help. You know what I mean? There's 2 sides to that story. So like, I mean, yeah, you're helping that person out that doesn't necessarily need that help. You're also helping out someone who really does need that help. So I mean, you can play it both ways. And you made it sound really bad, but you can also make it sound really good, you know?
But we already have programs for that. Like,
Are they good? Obviously they're not, because we wouldn't be doing this if they were.
There's also the case of some people can't afford food, like it's not always the cheapest option to get fruits and vegetables, so if they can't afford good food and they become obese because of that, then they're even more stuck than they were in the beginning.
But if they
Yeah,
can't,
but
they
It's
usually
not
get, like,
necessarily affording the food, because if you get a meal from
Well, I'm just
McDonald's,
saying like, oh, well, this person eats McDonald's all the time, why should we pay for their health care? It's not always their fault.
but if you look
but
at
you
like the
have the option, like you get, there's a welfare system here, like you get food stamps if you can afford it. You can choose those food stamps to buy fruits instead of buying McDonald's every day.
Everyone falls in that hole.
Even then,
to build on what Tracy said also, a perfect example of that would be our project system back in New York. If anyone's ever been in the projects, people don't really move out of that. It's in a kind of almost a never-ending cycle where, I mean, originally these projects were made for people to just live there for the time being and eventually move out of them. But what has happened over time is people have slowly become integrated into these housing systems, and they're not going anywhere. And healthcare is one of the big things that could influence something like such. It might not seem as such, but depriving someone of healthcare and having them spend a large portion of their budget on healthcare when they can't really afford it keeps them in that same pit that they've been trying to get at for years.
That's an intriguing point, but like, there's a lot of places like in Paris, or not in Paris, but in France, right outside of Paris, that are in the same situation as we spoke about the other day. And I mean, they have a great healthcare system here, and they're still in that system. Really just that much. And that's kind of what you really don't want to step into, because it's a slippery slope. If one thing happens, you know, the trickle effect could occur, and we could have more socialist programs throughout the United States. I don't know who's a fan of that. I'm not really a fan of that. Even though we love Paris and the way I don't like the way they do things though. It's kind of, yeah.
And are they actually deprived of healthcare? Have you ever seen a script count in the store that, like a Medicaid store? You know how much it is, like higher compared to any other like section. So it's not like they're being deprived of healthcare.
I mean, there's also, besides the complete
Half of them
lower
are on
class.
HMOs,
No, besides the whole complete lower class, there's also the lower middle class, the donut hole, all of those people.
Well, that's just one factor into many factors into the healthcare system. You can't just say, let's have social healthcare just because there's a donut hole. There's also many factors where do people really, like in the projects, like some people choose to live in the projects because, hey, I don't have to really work that hard, so let me just stay here because I only have to pay $5 every month because it's no work. And then some people, they legitimately can't get out because they can't find work or whatever, but there's always that double-sided. Just because there's a donut hole doesn't necessarily mean we should always move towards social healthcare.
That's a great point.
I just think it's going to be like, there's inequality, there's going to be winners and losers in every system that's set up, so I don't really feel like we should have to outstretch to help the losers, because I mean, I don't want to call the losers a bad word, but like, you can't like stretch yourself so thin trying to help out the people. Like we're built, the United States is built on incentive, and you want to have to do more. And by giving somebody something, I mean, I've seen struggle, and it's not a pretty sight. But you can't just give somebody help, you know? You have to get it. And they have to work their way to it.
Okay, can I ask you one question?
Yeah.
Do you think a government and a country like the United States should ever deprive any citizen of healthcare?
Well, they don't
I don't
deprive
think
them.
they're
They don't deprive them.
And you say
Why
citizen too.
Like there's a lot of immigrants and people who are here in America illegally. They're not deprived of healthcare. It's just that they don't work up to it. Like there's a lot of private programs.
Affordable healthcare.
Affordable. It's a free market system.
What about the child born into the projects who's denied health care? What if there's a kid who had no choice where he or she was born, but is denied health care? Why would I deserve health care more than that child? Because I was born into a middle-class family, why would I get health care and they don't? And they're sick their whole life and I'm not, because I was born into it.
Well, how are they deprived of healthcare?
If
Are
their
they just
parents
like,
can't afford it or anything.
well, still
If
under the free
there's no
market, there's
universal
still
healthcare,
Medicaid
there's
and
45 million,
Medicare Part D.
but they're not going to get the health care that I'm getting.
Well, that's because you pay extra for private healthcare.
But why do I deserve better health care?
Because
You
you
pay
pay
for
for
it.
it. Because you pay for it. We
But
live
that
in-
child didn't work for it. The parents, like, they were born into that.
And their parents should have the incentive to make their child
Humanity
better.
is just a really big loophole, and if you're born into the right caste system, which people say we're not in a caste system, but we always are in a caste system. You are just, I'm not gonna say fate or destiny. It just happens to be that because you were born into a middle class, your parents can afford private healthcare, so therefore you're gonna be healthier. Where someone who's poor, like say, what about like kids in Africa? Sure, they're born in Africa. It's not, they don't choose to be born in Africa, be born into poverty,
Right,
but they have to live with it.
But then why would we deserve more? Like, it's not
I'm
about
not saying
it's
that
not
you
about the
deserve more.
money. It's about why am I getting good health care, quality health care, and people on Medicaid?
Because you're paying for the luxury of it.
It's not about the money, but
It's not
it's
about the
always
money.
It's always at the end of the day, it's always going to be about the money. So I mean, yeah, it's wrong to look at these kids and say, oh man, they don't have health insurance.
Would you give up your health insurance for them to have health insurance?
I would go toward a universal healthcare system in order to ensure that everyone had more equal health care.
Yeah, healthcare is a luxury in my opinion. It's a necessity.
But then everyone does have some sort of healthcare. It's just people have different types. There's people who have private healthcare that they go to private hospitals, they get top-notch things, and then there's basic healthcare, which is basically saying if you have a cold, if you have like a minor infection, you will get covered. But if you have something like cancer, which is like probably like a multi-billion-dollar not industry, but just like, I'm not sure, I have like a section or something like that, how would you justify the cost of that?
I wasn't quite sure in Obamacare, does like the private industry, private health industry disappear?
No, you still have
It's still there? So I mean, I guess if that's the case, I'm not necessarily against it because the people who need it can still get it. And the people who want to have top-notch care can still afford to pay for it.
Put that at the expense of
Your taxes,
individuals.
because you're still paying more.
Yeah.
And I feel like the care of private industries will go down because if they have to compete with those that are public reimbursements going to be lowered, therefore they're going to decrease the amount, individualized healthcare that they can give. So they have no incentive to, go all out for a patient anymore. So.
And like they said, like your resources get distributed, all the resources get distributed to everybody, so you're not gonna get the top-notch healthcare anymore, like there's that chance also. There's a limited resources that they have to give out to everybody.
Like there's a reason why people fly into America to go see the Mayo Clinic or Mass Gen or MD Anderson Johns Hopkins, like Fidel Castro. Even he freaking came here whenever he was dying. There's a reason that our healthcare is, at its peak, we're the best. How many people from Canada come over to America just to treat, because they see, in the private industry, they see instant service. And it's even becoming like a service industry now.
So there's more incentive for the doctor
Yeah.
to work under private rather than universal.
You're saying our hospitals are so good, our life expectancy is one of the lowest in
Yeah,
the
that's because we,
That's because
this right here,
That's because we
and
have uninsured, 45 million people uninsured.
Well, there's
that's
another thing.
the
When you
diet.
walk around America, because this has really startled me since we started the study of our program. When you walk around America, you see a lot of big people. When we were in Spain, I don't think I've seen a really big person walk on the streets. Like someone who's like really like elephant sized. Even in France, it's like you don't really see someone really big walking around because they really look after what they eat and stuff like that. In America, we're so into luxury and into sweets and just not affordability, but the fact that it's just there. Like we have Pepsi maybe like every single day. We have fast food every single day. Over here, people like in Spain, when you go into a McDonald's, it's more of a luxury to have McDonald's. Like it's really fancy to go into a McDonald's. Back in America, sometimes McDonald's you would find like rats running around. Over here, it's like a 4-star restaurant or something like that.
You could blame the ignorance of people on the healthcare system actually, because if you think about it, people aren't going to the doctor as often. There's less incentive. When I go to the doctor will tell me my weight, tell me if I'm healthy or not, and give me my body mass index. If you're not going to the doctor often, you're not going to be getting that often. You're not going to be considering whether you are overweight or underweight. You might just look in the mirror and be like, wow, I'm fine, or you might not, and try to starve yourself. But
well, an individual knows if he's eating healthy or unhealthy. He has a choice, and you can't put the blame on healthcare for that. If a person chooses to have like fast food rather than a sandwich made at home, that's the individual's choice, and you can't put a blame on the healthcare for that.
But why is the individual choice better in other countries than it is back at home?
Because in America, there's fast food restaurants every other block.
We have fast food restaurants.
Not every other block here. How many McDonald's are in Paris?
A lot of people bike here, a lot of people don't bike back in America, a lot of people walk here.
There's
A lot of people
3
drive
McDonald's
in
in all
America.
of Paris. And back in the States, if you go into the Bronx, there's a McDonald's probably every 5 blocks.
Yeah,
Yeah, in Manhattan, there's like one in every second corner.
But I mean, my point was that it's because people are ignorant in America.
So at the cost of their ignorance, we should pay for their healthcare.
They aren't ignorant. They obviously know that when they eat McDonald's every day and gain 20 pounds,
Obviously,
if you can't innately tell yourself that, oh, this is an issue, then
But it's
why?
something that's become so ingrained into our society back at home where people can't really tell the difference between, is drinking one Coke that bad if everyone else is doing it?
That's one Coke though. But if you drink 5 Cokes a day,
You drink 2-liter bottles, like 2-liter bottles. I know people who do that every single day for dinner.
And you know the consequences of drinking Coke and eating food because there's nutritional facts on all the products that we buy. And if we see that we're exceeding the nutritional the amount of like sodium, the amount of sugar that we're ideally supposed to have in a day, we realize that we're doing something.
Not everyone has the education to realize that.
At home, but though they're advertising that there's there, you see skinny models, you see skinny things, like you see diet things. Wherever you go, you see it. The media puts it in you. You have to be thin. Like people know that you have to be in some way healthy. People, you just know that walking is okay. You know that fatty foods, you don't feel as well. You know you're getting unhealthy.
You also know that when you go to McDonald's, you're loving it. So.
Say not everyone knows the exact amount of sodium they're supposed to have every day, opposed to what they're actually eating.
So should I pay for someone's healthcare, or should I pay for their education?
What?
Should you pay for the healthcare or should you pay for someone's ignorance?
Because now he was saying that ignorance. Is it really, should I pay for their healthcare, or should I pay for their education to prevent them from becoming unhealthy?
I don't know, it's fine. Any other opinions on the situation?
I can't really defend either one because I don't necessarily know which system I like support. So, I mean, they're both trying to make fun. There's never going to be a perfect system.
Never.
And
everybody has their own bias, so it's really hard to get a non-biased opinion. True fact.
things are possible, actually. I mean, you see what we see every day. I mean, it comes from a place like New York. And I mean, I don't know how many of you guys are from New York, but like, it'll be completely two different opinions depending on where you live and how much money you make, you know, your background. It's hard. It's tough to tell.
Do you have any opinions, Professor, before we end up our little discussion?
It's very interesting. Second is, I think you did a good job. Tomorrow, I'll take that. Because we have a better way to get everybody talk. I think the bottom line for the Obamacare is one of the issues is whether you are forced to purchase health insurance or not. It's a mandatory health insurance. That's the issue. One of the major issues is for this generation, the issue is they don't want to purchase health insurance. Okay? And most people is understanding what is sort of health insurance. Because it looks like you purchase a voucher, you walk in, and you are going to eat every day. That's health insurance. You just want to walk in, and then system has taken on me everything, and you guys just mentioned the education, the eating, those kind of things. That's different things. Okay. So, but the issue is, should we pay? Should you guys pay now for the future? Okay, so that is one issue. It's really an issue in today's environment is argue whether a mandatory health insurance purchase should be done in the U.S. or not, especially that would violate the United States, like a U.S. DAC. You know, you cannot force, the government cannot force someone to do something. But now we are forced to buy health insurance. So that is one issue. A second issue is, I think you mentioned a lot already, a lot of good things in Obama health care, I think, focus on preventive care, pre-existing conditions. Those are all good, okay. But like, what is the level of care we need to provide? So, what is the so-called basic care? I'm not sure a system can afford provide the best care. Yes, the thing we understand is best care. I want everything, but there is a basic health care should be. Maybe that is the level. Everybody should have some basic care, and then there's another level. It will move up, or like how people can get those care or not. But of course, that go back to a different value system. You know, how can you have that? I have that. You know, so that's again like the young man said, money talk. Yes, money talk. But it's real hard to get away that money system in a European system, socialized system. Is that great? It's great, but if you don't have money, you still cannot get a good care. You know with you because there's still a system somewhere you can go to the best care. Canadian system, same thing. U.S. system, you just go because you have private health insurance, you get the best care. Okay, you go walk into your doctor, you say, I want the MRI, you get it. Okay, that's in the U.S., same day. In other countries, hey, young man, wait. Okay, unless this is an emergency. Okay, otherwise wait, just keep waiting, 6 months wait. So each system has its own benefit and weakness depend on the, like I said before, political environment. Okay, who is in power, political environment, but basic value is there's certain thing there. It's what kind of basic care we need, what kind of the preventive care concept, and also like pre-existing condition. I think HIPAA, insurance portability, like if I work for her, okay, I hate her. I want to move to work. Okay? And then they tell me, oh, wait for 3 months. Okay, otherwise if the new insurance cannot cover, so that becomes the issue. But you have national health insurance, then you can move around the different jobs. So a lot of things, national health insurance has its own advantage. But then come down to the issue, how you control the cost. Control the cost. And then all those students, they hate me to cut their salary. Yes? They say they take 6 months. Now 6 years study, and then we reserve this, okay? Several years ago, physician and healthcare provider had the same very good salary. At one point, up to the point, the healthcare system just cannot take this. So we have all the managed care concept comes in. Third year, you will learn more about that. Okay. Then suddenly they tell how much you can make. And you ask those doctors, they don't like it because at one point I make a presentation to the community. I don't know some doctor from the medical community there. They just argue with me because that's around 1990 something. And that I figure out because I really touched a sensitive issue. They are paid. They are paid. Okay? But after that, all the managed care environment comes in. You learn HMO environment, capitation environment, they tell you how much you can receive upfront. That's a system. Then suddenly you get used to that environment. Several years later, you are used to that environment. This is the way here. I'm part of government employees. Okay? I'm a healthcare provider, but I'm a government employee. I don't want to get used to it. Everybody understands that. It's fine. It's just how you used to that. But the point that go back to this thing is another system is developed behind the political system. So you guys talk about donut hole. Okay? Donut hole is not that simple. Why pharmaceutical industry is willing to put out money to fill out that donut hole? Is that simple? No. Because there is a under table deal. Okay? Is that U.S. government will not allow the direct import of foreign medication into the U.S. Indirect cost control. So there is some kind of negotiation between out of that. Okay? So a lot of things is through the political process. But the good thing is at least that donut hole, we fill out that donut hole up at the year 2020. Yeah. Okay. And then at least more people can afford medication. But the basic stuff for you guys probably more focus is what is the so-called socialized system here? What's the major difference? Okay. The only thing, like I mentioned that in class today, they don't eat McDonald's but they smoke. I'm not sure which one is worse. Eat McDonald's or smoking. I will eat McDonald's.
Look at Spain. Everyone's in Spain.
Really?
Apparently their quality of healthcare is the best.
Yeah.
Because they eat less McDonald's.
And
so maybe
so which one? Now it's up to your evaluation. But you guys can discuss more on that social system and a free market system. U.S. is going to have a so-called Obamacare, and we see what happens. They're going to repeal. I don't think they're going to repeal the law. But even with that, we still have a free market system built in that Obamacare. But with this real socialized system, only one health insurance company, and I think that probably is more of you guys focus on this because it's a totally different system. Your pharmacist, you are part of the government employees.
I just want to say one more thing.
Yeah, go for it.
I don't know how I feel about the, you said one of the cons was the political leaders being able to control who gets what. I think that's really, really dangerous and can end up really, really bad for a lot of people. And I feel like that gives some people an unfair advantage, and I just don't want to see a system where that takes, where the healthcare is an issue that can be voted upon, you know what I mean?
That's also an extreme opinion.
It is an extreme opinion, but it's something that could potentially happen.
Like a national phone.
Yeah. I do get appreciate you guys.
Thanks for coming. Anyone else have any other points before we close this discussion? Nope. Alright, thank you guys for all coming.